Hi, I'm Dr. Ayyappan V Nair, and this video is going to be on the principles of pediatric ACL fixation. So this is a regular ACL surgery done for an adult patient. So here in the adult, the main difference compared to a pediatric is that in children there are growth plates. Growth plates are, you can see these lines. These are the growth lines which are usually found at the ends of the bones. In adults, we don't have that, so we can put a regular hamstring graft into a tunnel in the femur, in the tibia, fix it on both sides. So fixation to tibial side is sometimes with a screw, and this side it will be with a button. If you do the same thing in a pediatric age group, the problem is going to be that, so if the tunnel is going to pass like this, the tunnel will be passing through the growth plate. So then you can have a growth arrest. That means the growth in that particular area would be destroyed, and this particular patient could be having some kind of angular deformities or growth disturbance in the knee. There could be a bend in the knee or a curve in the knee. So now, in such cases, sometimes we do something called as a trans-epiphyseal, means that is above the growth plate, the tunnels are put like this, so that we are evading the growth plate. So what are the results of this? Results are not great. The patient don't have great results. There could be rotational problems, there could be instability problems. So now, what is the other technique? The other technique is I have to modify this particular technique called the trans-epiphyseal technique. That means I have to still go through the physis or the growth plate, but I have to make it safe. So when I look at scientific data, when we look at scientific data, we find is if less than 5% of the growth plate is affected, there is no growth arrest. So now if we look at what is this 5%, how do we get to this 5%? That means if the tunnel size is around 8 millimeters or lesser, then only 3 to 4% of the physis or growth plate is affected. That means it is always safe. We can use this particular technique. We can grow through the physis, but put a smaller size tunnel. Second is the tunnel should be vertical. The more vertical, less of growth plate is affected. If it is more towards like this, horizontal, you can see that more area would be affected. So make the tunnel vertical. Size should be less than 8 mm, and we should never put any hardware, no screws or metals or any kind of hardware should not be coming into the growth plate area. So these are the principles of ACL fixation in children.